we all know that the field of health, when we talk about innovation, it gets a bit more complicated because the users are different to probably users or stakeholders involved in other areas. When you look into various other industries, stakeholders identification is quite straightforward. And when you're thinking of the user of your product or service, it's either a business or a customer, an individual. Whereas when it in health is a bit more complicated than that, you might have various users that are having different use from that innovation, and different stakeholders which had different interests on that innovation. So the innovation management is a bit more complicated. And not only you need to think about the users who are your target market or the target users for that particular innovation, but also you need to think about the stakeholders that has other benefits in the innovation. The benefits can be quality improvement of the service for a hospital, whereas the end users are surgeons who are using that particular innovation. But everything now is patient-centered. So at the end of the day, users are patients. So how can you identify those and separate them and think about innovation management, considering all of these people? It's very difficult. So that makes this field quite unique, I think. And the second thing that makes this field unique is we mainly deal with people's lives. So if an innovation fails, it's not just like you're losing money or, you know, there might be a reduction in your production line. It is about someone may lose their lives or similar things, or it affected someone's quality of life and so on. So that also puts pressure on the innovation design process. And there are lots of rules and regulations, as you may all know, that needs to be followed. They're quite strict in allowing an innovation to be commercialized in the health industry, and we all know the reason why. So I think these two reasons are the main reasons that we are having this SIG, really, because the innovation management should consider these elements. However, nowadays, well, you all know, because of COVID, things change a little bit, and we had to be quick on our toes. We had to, as an industry, sometimes decide in a very short period of time, such as the vaccines, if we can do the vaccines or not, if it is safe or not. And that broke some of the barriers. Maybe some of those barriers were there just from the bureaucratic point of view. So that those were the ones that had to be broken because of the situation that we were in. And secondly, health industry become a bit more risk taker. They had to. So there were a lot of risk taking happening, and there were a lot of innovation that being accepted, from disruptive innovations to radical innovations and so on, because of the situation we were in. So there are changes now in the industry that is happening, and if you are someone who is interested in studying this particular field, it's good to look into the WHO's new release. Basically, it's an August release on innovation in health. There are also a lot of other documents within NHS, in National Health in England, that are talking about how COVID has affected the innovation management, and they also talk about the successful innovation, for example, within this area and so on, which can give you some ideas of the changes that's happening, which needs to be incorporated in your basically perspective to research. When you're looking to do studies in this area, you need to be aware of these changes, or the new rules and regulations, perhaps, and so on. So I stopped talking now, and I would be really interested to hear from you if you have any kind of ideas, if you have anything that you think it's worth publishing. If you don't mind presenting it to us, and then we're going to look back at the framework that we did on the Kickstarter session. which is really about finding a real problem in the world and looking to solve that problem. And I think, luckily for us in the health industry, there are a lot of real problems, so we have no problem finding those. So yeah, I would love to hear from you now, and then we can discuss your ideas and so on.
Great, thank you, Mona. Well, we are lucky because Dinah and Alina have done quite a good, I think, reflection about what they would love to do. So I will give this stage to you. You can select who starts first. You're already there, so.
Yeah, let's start with Dinah, please, if she's okay.
I'm fine with that. Thank you very much. Maybe, Leandro, could you make it larger so we can read it better? Yeah, perfect. So very nice. Thank you very much. So my basic idea comes from one of the past projects I've done before all of this pandemic and digital disruption that has really impacted us in each and every area, and of course healthcare is not an exception in that sense. So what we see is that a lot of innovation is going on, and pandemic has really accelerated it. So my idea would be quite simple, is that having a sort of deep dive in one structure, but then tell me if you think it's appropriate as a method, and see how virtual collaboration has contributed to digital transformation in hospitals. Because I found one of the papers actually quite interesting in a German hospital, where they did 16 interviews in a hospital. And actually they zoomed it out how this virtual collaboration helped them. I would like to go a little bit further, and I explain why. Because in previous project we did with one of the great hospitals, we tried to implement marketing perspective in the hospital, and you know what it means. It means a lot of doctors and physicians shouting at you and saying, what the hell you are going to tell me? So exactly, I see your face and I see what. So you can't speak about customer centricity, you have to speak about patient centricity, which is fine. But still, I think that some marketing, and you know, my background is marketing, some methods and some approaches can be taken from marketing, and they can well be used in order to increase also the patient support and how especially we communicate with the patients. So the idea was to really understand by this deep dive in one structure to see how, to what extent this virtual collaboration has really, how should I say, supported this stuff, and how it has benefited, what type of benefits it really paid to their support along the patient path. So the idea would really to be go in quite open and see, maybe I would like to have a suggestion, what kind of stuff you would suggest to interview, because in the paper I'm referring to, they were not very much selective in whom to interview, whereas I think it is really important to be very focused with semi-structured interviews on whom you select before, because for instance, like director, financial director are crucial persons in that, because they have the overall overview of the situation. So I think they also have the strategic overview of things, and they see why and what was really taken from digital side to support this pandemic situation, and what has worked and what has not worked. So the idea would be really to understand what were the pitfalls and what were the main, how shall I say, benefits of using virtual interaction along that situation. I don't know if I may dare, but maybe it could also be an idea to understand to what extent also other tools were used and who have potential also disruption potential. So we all know that online consultancies are going on, and so this is a trend, but how can you guarantee the quality? So is this the hospital that guarantees the quality? And you know what they did and what they did not, and what they allow and what they do not allow. So I saw this study in Germany, and I think a Swiss study could be a good parameter to compare it. So that's basically yes, the idea.
Thank you. Can I ask? I think it's very good idea, and it's very timely because of pandemic. So when you're saying virtual communication, do you mean that consultation, like a video calls and?
Exactly. So, for instance, video calls with patient through Zoom, through Teams, through WhatsApp, whatsoever. The problem is, of course, how can you control these channels, and what is the hospital policy? To what extent you allow implementing them, and to what extent you don't?
Okay.
This has to do a lot of also with the change management and culture, of course.
Of course, yes. So are you interested to look into this from, because you said about the quality of, you know, what, and is this hospital's responsibility? And so to bring that high quality, or is it, so are you looking at it from a hospital point of view or from the users? Hospital
point of view. So what could we potentially suggest to other hospitals? What has worked and what has not?
Okay. And by quality, can I ask, how do you define quality in the context of your work?
That's a $1 million question. So
it is.
I might rephrase that thing, because I know, I mean, quality is a tricky question, and of course, someone has to guarantee it. So, of course, the one of the results, I presume, would come out, and what also has come out from the German study, is that, of course, it's critical to allow, you know, to put the border where you can and what you cannot do. So in that sense, all the collaborators of all the staff of the hospital has to really follow the rules very strictly, because, as you said, it's not about having fun, it's about people's lives.
Yeah, and what would be interesting, I mean, I think the question is like, so if a hospital says that, yeah, my husband is a doctor, so he's a surgeon in hospital, so they did a lot of video clinics, especially from home when they were complete lockdown. And that was a lifesaver in a way, but at the same time, some patients were quite unhappy. So that's the reason I ask quality, because sometimes the hospital says, okay, we did it, and it helps us to not have blockages in the clinic, in the waiting list. It got us going. So it was a really good tool. How effective was it? From hospital point of view, would be numbers and money and, you know, other things. Whereas from user point of view, it is they need to answer if they were happy with that form of consult, if they felt that they could express, for example, their discomfort or their problem as they could in a face-to-face and so on. So if you want to exclude the user part and just look into the hospital, then yes, as you said, the quality needs to be defined. What really is that you mean here? Is it about again, that like money, patient number, whatever procedures, the terminologies they use for that part? And then yes, an interview definitely with the director, somebody who is aware of the strategic decision making and so on, but also staff who actually ran it, like the people who did this video conferencing. Maybe they can give you some more insight into other areas of quality, such as staff satisfaction, or such as, I don't know, if they felt connected to the patient, if they, so it is something a bit outside maybe merely hospitals' effectiveness scale, but more about the staff's how they felt about it, and how they found it useful. So when they used it, did they have more following up to do, or were there more complaints to kind of add to the workload and so on? So there are some hidden things that might not be picked up by a director or someone on the top level, which you can find interestingly to be picked up by people who are actually users of that virtual platform. So that's my opinion on who to interview. I personally find it useful when I go with semi-structured, as you said, semi-structured, and I go with some space to give them some space to talk openly. And from that qualitative data, then you might kind of extract some very interesting information.
That was the idea, yes.
Yeah, that's a good idea then.
Thank you very much. So yes, I was pretty much careful about defining the quality, because of course we know that patients can't evaluate the clinical quality. So that's why I would not, they can evaluate, of course, interaction quality, but they cannot evaluate the patient outcome, of course. And this is the big delicate question. So physicians from that side, they are able to evaluate it a bit more. So they can say, was it really useful? Did I get in touch with patient, and could I really transmit what was the policy and what he has to do?
Yeah. Yeah.
Would you suggest also implementing the digital monitoring, like remote monitoring into that? That's very overlapping, you know. It's telemedicine, and which is, of course, as the physician has the data, he can also be very much more reactive and to give feedbacks that are more precise. So my other question was, would you suggest also to touch this point with them?
Yeah, as you said, there are a lot of overlaps, but you have to also be aware of the differences. So if you can kind of maybe separate them from that point, I think you have a really rich data to present at the end of it. So okay. Yeah, that's also can work.
Thank you.
Thank you. Very good idea. Thank you so much, Dina, for presenting. So do you have any other questions, or
no? Thank you. I think it's enough for now. So I'll see how it works, and I'll try to carry it through. It's not an easy thing, but anyway, I think it could be very helpful. So, and we also have this case of Germany who has already done that. So I think we could offer more insightful information for hospitals they could use. And of course, third point, this is cantonal hospital. So of course, the limitation of that is that we don't consider the private hospitals, which is a little bit different. Mm-hmm. Yes, that is a limitation, and maybe a good idea, but that complicates, of course, the setting. Yeah. Could be to go and also ask the interviews in a private hospital, who tendentially they are much more advanced from digital point of view.
Yeah, there definitely are differences, especially, I mean, in the UK, it's a huge difference if you go to a private setting, and you definitely need to kind of, either it's a comparing study, then yes, but not just stick to one setting. So yeah.
Okay. Thank you very much.
Good. Thank you so much for presenting. Can I move to then Alina, please?
Hello, everyone.
Hello.
Yes. Well, I cannot stop myself because during the Diana presentation, I also got some like brainstorming. If I can add some points, I do not know, maybe they're not useful at all, but it's something that I was thinking about, and you touch them like exactly in the last seconds. First of all, I was asking me, through all your presentation, do you talk about public hospitals or private? Because there is a huge difference. And The second about institutional context, like a country. So Mona said about UK, you said about the case in Germany. I'm in Spain currently, and I can say that while public hospitals are not that developed digitally as a private, for instance, here it's already implemented digital system. So there are digital visits, there are digital appointments. I would say they may not use that modern technologies, but they are going step by step already. So maybe it would be also really interesting to see different countries, different institutional contexts, to see in which countries maybe public-private differences there are. And also in beginning of presentation, you mentioned like the platforms, whether they use Zoom, Teams, or other. In Spain, public and private hospitals, they use their internal platforms. They do not go to these commercial platforms. So the data protection is a bit better. And for instance, you're really interested in interviews, but maybe you could go to then to mix method, to combine interviews with survey data, because each visit to doctor is finished by surveys. That, for instance, in public hospital, I believe the survey belongs only to patients, but in a private, they go both ways. Survey for patients and survey for doctor. If for patient is 2 points like audio quality and the doctor satisfaction, for doctor is just audio quality. I do not know, it's some insights from Spain. You can take them or not. Okay, but I really like the idea, and it was like brainstorming. Okay.
Thank you very much, Alina.
Very, very
Very
helpful.
useful.
Okay, fantastic. Thank you. And yeah, and I would like to tell a bit about my idea as well. So, okay, it goes that way. So what I was thinking about, what I'm interested in is co-creation processes in healthcare sector with a focus on workshops and training sessions between different stakeholders. And here we could define different groups, as Mona said in the beginning of her presentation. I was thinking about the groups as entrepreneurs and corporations who might develop solutions. I was thinking about stakeholders as a patient or their relatives, and one another stakeholder as a doctors, because solutions could be for doctors or solutions could be for patients. And now after the first presentation, I also think it might be even like solutions for hospitals. And what is interesting for me, like my thesis is based on a form of collaborations. And I have studied a lot open innovation collaborations that are knowledge from external agents. And usually this collaboration between two firms. Then in innovation literature also is started to develop a topic of user innovation, when someone participated in development the solution for themselves. And I believe the co-creation processes is also involved with part of the third part, not only the user and the producer, but someone who also will be involved in the process. So we defined stakeholders so far, what is the co-creation processes. And what I think interesting data source is the training sessions or workshops, co-creation workshops organized for good stakeholders. Now, co-creation sessions, workshops, they are so popular. There are so many varieties. You can find them in any application, in any hospital. And I believe there is some, even like a chaos. There is no systematic evidence which of the practices fixed, how, for instance, workshops were organized, what has worked, what has not. in some good cases, we could find the manuals, we could find facilitator materials. But as Mona said, as a second point, it's about protection, and it's about impact from life of people. And when we talk about healthcare, how can we trust to that workshops? Should not they be done in some systematic manner, replicated and replicated till we'll guarantee the particular result? So this was my my idea, my inspiration. I do not know how to realize it. Should it be like some of way which could be is to find organization or to find a group who organize their workshops and systematically observe them and make fix the practices that they do, following this path, or to be a facilitator and organize a workshop, propose it for some hospital or for some entrepreneurs, and then to control more the process. I believe it could be really rich data source, but the idea is really raw. It's really raw, you see. So I think, yeah, that's what I have.
Thank you, Alina. I think it's a really good idea, and I am quite fond of applying models from other areas to health. I think that's something common, and that's something that bear in mind the differences and consideration within the industry can work well. So my first question is, are you going to kind of apply, because you talked about your dissertation, are you going to apply any co-creation model throughout this research? Is it something that's like a starting point, or is it going to be a completely inductive methodology of looking for insight?
Well, I'm in a few months about to submit my thesis, so I'm thinking more about postdoc, about more further projects. So now it's like really like idea. I have participated in several workshops, and I was looking in academic papers, in a published peer review, for instance, what are the procedure for workshop organization. And it was like a starting point to discover this topic. I don't know, maybe you could recommend me a paper which you have seen a good example when they organize workshops and then they bring it to academic level.
Well, I on top of my head, I cannot remember a particular paper, but I can understand totally your point about, well, here is really difficult for the co-creation workshops to happen because of the ridiculously heavy workload of staff in hospital. But if it is something, as you say, is something common and it's something that's happening, it's a really good idea for you to look into it. And of course, you come up with two methodology. The reason I asked you about the framework and the model to start with is that it might affect your methodology. So, for example, I give you the two routes that I have in mind. First of all, if you're going to apply a certain co-creation method as a systematic step-by-step basic methodology to implement a workshop from whatever industry, which proved to be very successful in health industry, that you can either create a survey or create a focus group guide based on the model. So the model can inform your focus group guide or your survey, and then evaluate if based on that successful model within, I don't know, fishing industry or whatever, they are actually following an effective footstep. They're following the effective steps of implementing the workshops, the training workshops, training sessions, and so on. And then discuss at the end that if it is in line, or if not in line, then, you know, why not, and so on. Of course, you need to modify your model. You're not going to exactly apply it. You're going to modify it based on the setting and so on. but if you're looking into effectiveness of that, the workshops, then yeah, observation is really good. I'm a very human-centric researcher myself, so I quite like to look into that human interaction in a real scenario as much as possible. So observation give you that, but then the effectiveness needs to be, there needs to be a scale that you can measure effectiveness. Would the effectiveness would be the participants of the workshop's opinion on the workshop? Or is there a particular outcome that the hospital acquires from that workshop that if it is achieved, then the workshop has been effective? So if you have something, a scale or something to measure the effectiveness of the workshops that's running, then maybe you can look into the effective ones and look into, observe and then see the differences between the workshops that's running and that effectiveness measurement at the end. And that way you can give some insight. And maybe from the data, that can be observation, that can be, you can record the sessions and look into the whole content, and then see the differences between effective ones and not very effective ones, and then create a pattern, basically look at it completely inductively and create a pattern, create a model based on, you know, the level of effectiveness. So I think these two, I mean, it's a bit difficult and time consuming, but this can also give you something at the end. I don't know how many of you are there or how much help will you get, and the data protection wise, if you're able to do it. But one thing that also I did with one of the other researchers I did was I asked participants to draw me a map. I asked them that how, well, it was about something, it was about an innovation adoption, but I asked them how do you think, for example, that innovation that comes to hospital needs to be communicated and adopted by staff. And then I asked them to just draw it as a map. So they use some visual elements to kind of show me what they think is better. And that gave me a lot of good ideas of like what they really expect to see. And sometimes visual is helpful because here in NHS setting, when you are with your seniors, you wouldn't be able to really speak out. But if you want to draw it, then no one sees what you're doing. So you can just fold the paper and give it. So again, you know your setting better. So maybe by knowing your setting, you can think about, well, what is the best way you can make them express really. But the main thing is either you have to use an effective model, which has been proven in somewhere, so that you don't need to really worry about effectiveness of your workshops, or you need to find a way to measure or evaluate the effectiveness of the workshops. And then when you're doing your observation or focus group or content analysis, then there is a benchmark for you to kind of give insight. I hope it's helpful.
Yeah, very helpful. Thank you. And may I ask you a bit more about this visual maps, about this exercise? So how you proceed with them? Have you analyzed them? Have you summarized them? What were next steps?
That there were two things that I found very interesting. First of all, the visual map happened in focus groups. So I had long focus groups, dinner provided. So they were happily eating and chatting, and I left the recorder on. So while they were, I put them in groups of 2 or 3 to do the visual mapping, and I put them in groups of people who they know. So like if they're getting on well, or if they're in the same level, so they were comfortable. For the visual itself, I just put them all in front of me and collectively looked into, for example, if one element is picked up by majority, if there was a relationship that's been picked up by majority. So I did a visual thematic analysis really on that visual map, the same thing, but looking into the relationships and factors. And the second thing, which I didn't expect to actually be useful for me, was the conversation that happened during that visual mapping. And that was very useful because I got lots of insight about innovation and adoption in hospitals, and how, for example, one of the main themes where people started telling that they don't really, it doesn't matter if we say anything, it's not going to be valued. You know, they were very comfortably talking to one another because they were also drawing something. So that gave them a bit of a comfort zone maybe. And so I actually asked consent, so that way they were all consented data, but that part of data gave me some very unexpected insight. So I don't know if that's something you can do ethics wise. But for visual, yeah, I just kind of did like a visual thematic analysis, really.
Mm-hmm. Interesting. Thank you.
Thank you so much. It's a very good idea. It's a very good topic to work for. And are you also going to look into the online workshops, or is it just physical ones?
So far I participated in the physical ones, but maybe the time is changing. So maybe soon it could come to online, right? Or maybe we come back on a site again.
Yeah. So yeah, so if you have any opportunity to look at online ones, then yeah, by all means do, because as you said, time is changing. So there might be more of those rather than physical ones.
Yeah, right. Thank you a lot.
Thank you. So we don't have anyone else in the Padlet, but do we have any newcomers or new entries?
Or even additional comments by the others.
Yeah.
So welcome.
Or if you have any burning ideas that, you know, you think how to get on about it, we're happy to discuss it.
But Mona, I wanted to launch maybe it's a super broad topic to discuss about the healthcare industry. You know, what's your position about the video and film methods in the healthcare? So I was thinking, when Alina was talking about workshops, I was imagining what kind of new service or new products may happen within an hospital. And I was thinking, well, maybe, but I'm not at all an expert in that area. I think that a lot comes doing. So it's about, you know, continuous improvement while doing. So I was thinking, what is the point of a video, you know, a video research method? So you record, of course, there are some, you know, limitation and ethical concerns to tackle, but I know that in organization science published quite a few paper on using video methods in the healthcare, but I just was curious about how to use it and if you see it.
Absolutely. I think I totally really like the video methods. And as I said, I'm a very human-centered researcher, so that gives you a lot of good perspective. I know a very interesting one that's been done in Torquay Hospital in Devon, and they did a user experience one, videoing someone in a patient's position. So a guy, the researcher, lied in the bed and assuming that he's a A&E patient for a couple of scenarios. So he was there and he videoed I think it was on his forehead. So it was completely like a position of someone, whatever person sees. And they were pushing his trolleys to the areas, you know, they were taking him for x-ray. So there were a couple of scenarios that really happens in A&E. And it was a really interesting research, how user experiences A&E and how you can improve the service by some very simple changes in, for example, words in the ceiling, you know, or when when someone comes and talks to you, how would the patient actually observe, you know, the eye gaze and so on. So, but that, as you said, Leandro, it's very tricky ethics-wise. I'm sure my university will be having a heart attack if we want to do such a thing. It's easier coming from a health setting in the UK. It's coming from a health setting. They put it forward as a quality improvement practice, and then the ethics is a bit looser. But of course, a lot of if you can go through the ethics procedure, and what you were looking for is a experience, you know, something that can be measured visually, and it's important to kind of be observed visually, then I think it's a great idea. But I couldn't do it as a researcher personally. I didn't, when I was even recording voices, this was, UK, I think, is the worst place to do research in health industry. They are really, really strict, and there are a lot of systems. So if you can find a health setting that are happy to collaborate and they go with the ethical procedure, I think that's easier to be done. So have you ever experienced, any of you participants here, have you ever experienced any video recording kind of research in the field? Or have you ever seen any, No. It's quite rare then. What about observation? Anyone? Do you think it is, do you think it kind of resulting to suffering the confidentiality, data protection, these kind of methods in the health? What is your opinion?
Well, if I may, I actually had workshops with physicians, and then we gathered the quantitative data from patients. Of course, it was approved by the ethic committee, because otherwise you can't. And actually what we did is we gathered paper responses, and some of the patients included images in their responses, which was quite shocking. Okay. Because of the scars, because of the things. And I personally, as a researcher, had to transmit this information to physicians, which was not that nice. And it is, you see, as we mentioned, it is about quality, perceived quality of the patient, because, you know, even if he is not a physician, he understands something and he has his own perception, which is difficult to match with the physician perceptions. And this is a whole big area of research, I think. But yes, we did that, and those images were actually used for the workshops and discussions. So that was sort of a projection of what patients feel and how they feel, and how we can improve this customer centricity and this patient centricity in the hospital, and how we can act also with other doctors from the territory. There is also a very interesting area which is very relevant for many hospitals, is the actually the doctors from the territory, those who send the patients to hospital. So we did focus more on that. So how you can improve the interaction with these doctors, basically how you can support them. Because what we know is that private structures, of course, support them more, and public structures do not. And there is a quite big gap in that area.
Absolutely. I think that's a very, very good point. And when it comes to interaction or communication, I have a colleague who is doing microethnography. It's not in the health field, but it's in a business, it's in design. And we wanted to ask her to join the team when we were doing our focus groups, to look into the communication between various levels of staff, like seniors and juniors, and see what is the problem. Because one of the problems at the hospital, the questions I had to put forward for our research was that people don't know about these innovations. Their communication is missing. Something's happening here. And we said, it is not all about, as you say, it's not all about perhaps what we write down, transcribe, or what we hear. Sometimes it is the body language. Sometimes it is, you know, some other elements, and a microethnographer can pick up on that. But there was a big no. It's a no videoing, no someone observing, no nothing. So we couldn't do that, but it is very important if we can at some point. So if any of you have the ethical go on it, I'm happy to travel to your country. Maybe try it there. But yeah, absolutely. Thank you so much for sharing your insight, Matisse. So the other kind of participants, Antonia, are you also working in the health field, or you're just interested?
Yeah, I'm quite a newbie to research, and I'm not working in the health sector, so I was just interested in your discussion and helping Dinah and Alina.
Oh, good. So did we put you off, or are you still interested?
I'm still with you.
Okay, good. So are you doing like a research role, or are you studying, or?
No, I just started at the university to do my PhD. So yeah, I started this month and used the chance to register here. So yeah, I'm enjoying all the discussions and yeah, the whole process behind and how you develop such a paper and the questions that come up to both like experts and the ones who want to do the research. So yeah.
Do you mind sharing your research topic or dissertation? What area are you working?
In digital entrepreneurship.
Okay.
So yeah, but I haven't found my niche yet. So
Well, you started this month, so
yeah.
it'll take a bit of time. It's good. It's good that you have you here, and digital entrepreneurship is such an interesting area with a lot of really interesting research. So ISPIM is a very good place for the discussions around it, definitely.
Yeah, I already learned that from Daniel. I think some of you also know him. So yeah, he's quite involved in ISPIM as well. So probably I will see some of you again on one or another conference.
Yeah, thank you. Really good to see you, Antonia. And Rovian, are you? Do you mind if I ask if you're working in the health field, or you're just here to see what's going on? We can't hear you.
You know, Mona Rovian
equipment.
Oh, that's great. What time is it? What time is it, Rovian?
Yeah, 7:30. not too early.
That's good.
Oh, where are you? Oh, you're Brazil. 7:30 at night?
Morning.
Oh, okay. Oh,
yes.
so it's very early.
Yes, actually, I'm here to learn. Of course, I probably know nothing about healthy. So yeah, because my project, my thesis will go around kind of a justice-based approach on governance, and I'm working with platform-based ecosystems. So actually, I was here and working my presentation for. I have my. I need to present my project, my thesis project, next week. So I need to kind of polish the presentation, and but I'm really glad to hear you all, because I learn a lot with you all, and of course, and hope I can help in some way, although it's not my area.
Thank you for joining. I think ecosystems are very interesting area to work. And well, if you're working with the government, you probably will hear something about health.
Yeah, sure.
How is the health system in Brazil?
Oh my God, it's kind of a chaos. But actually, it's interesting because I see some reports saying that it's one of the best health systems in the world. It's of course it's almost entirely public, so we have access. Of course, they have their issues, no doubt about it. We are heading, maybe it's not in a good way, because kind of all the entire health system, it's kind of open for private, and I'm not sure that we are going the right direction. We have some issues with some health plans that was using some doubtful methods to treat COVID patients. It's a kind of awful because they are, it's what I know, I don't know all the story, but what I know is that they was treating people with not proved medicines. I forget the name now in English, but you know what I'm talking about. And they was kind of changed the, I'm not the health system, but the protocols of the patients to say that they were dying by another disease and not COVID. So they kind of masking the problem. They was trying to show that the plan worked better than the others. So some kind of corruption in the middle of this thing. And they had some kind of support from the government that should be kind of impartial, not partial on this situation. So I don't know, it's kind of complex, and I'm start to have some doubt if that we are going the right direction. But yeah, Brazilians' issues are big.
We have a big country, a lot of people.
Yeah.
Yes, but I've heard about the health system being very good before COVID. It was something I read before COVID, not during COVID, but also Cuban system. I think I read that they're very good. It is something that I kind of put forward as examples because I think something is missing in European-based research is to benchmark like countries such as Brazil or Cuba or the health system and look into what makes them successful, because they're not necessarily very economically very strong. So there should be something within the system or structure that is really working well for you. But yeah, it's a shame, unfortunately, lots of controversy here and other countries. I think when the government wants to show that they're on top of things, sometimes, yeah, things happen and things go wrong. But hopefully, let's fingers crossed we pass the bad stage. So hopefully we should be better off soon. Thank you very much for joining us. I think it's very good to have people from different continents. It feels more international.
Right.
Thank you so much. If anyone has any questions, you know my name, so you can find me. Google me, you'll find me. Email me. I'm always happy to be involved in any discussions. I know that you're all expert in your field, and Antonia will be very soon expert in her field. So it's always good to connect with all of you. And in LinkedIn, connect with our the SIG webpage, ISPIM SIG in Health and Innovation, or connect with me, and I'll be more than happy to have any discussions with you and answer any questions if I can. So lovely to see you all. I hope it was a useful session for you. So Leandro, I leave it to you then. Thank you.
I just wanted to thank you, Mona, really. Thank you very much. It's super appreciated. You were really, helpful for improving the paper ideas, but also for, some very important learnings from a PhD perspective, So research is something hard, and talking to you, it seems, encouraging, talking to people and talking to expert researchers like you is always, a source of, satisfaction about this process. It seems a little bit less difficult to do it. So thank you very much.
Thank you.
Appreciate.